INFORM is a registry study which was started in 2015, which is actually a large molecular platform providing comprehensive molecular diagnostics, but at the same time also provides clinical follow-up, so that we also can look back what certain alterations and treatments brought for benefit for pediatric patients. As I said before, it's a registry study, meaning that we are not, it's not an interventional study, so there was no clinical intervention in that sense. Patients received diagnostics, and treating physicians could use those reports of molecular alterations to base their clinical decision-making on. And so they were completely free to decide what to do with this information. After the molecular alterations were identified, we had a weekly molecular tumor board, and in this molecular tumor board, an interdisciplinary group of experts weighed the alterations from very high level priority to very low level priority. And we found in the study that most, especially the very high level priority level targets, really benefited pediatric patients when they were treated accordingly with targeted drugs. I think the most important conclusion is that for that precision oncology for pediatric patients is feasible, also in an international multi-center setting, which we did. We had eight countries in there, and at the moment it's already a lot more. But also that that patients really benefited from this diagnostics. But critical point, this was only a small group. There is still a large group of patients who didn't benefit from treatment because they didn't receive the according treatment, or because they didn't have a good target for potential treatments. So in the future, we still need more so additional layers of molecular or other diagnostics for the other group of patients which at the moment don't benefit. But also we need more drugs and especially clinical trials in children. So I think with INFORM, we have shown that pediatric precision oncology is possible. And I think that since we are also giving benefit to patients, we should offer these diagnostics to all high-risk relapse patients, and maybe also in a somewhat earlier stage. We have shown that it is possible to provide benefits for patients. So we need to work on more access to drugs in clinical trials or off-label, as we did it now most of the times. Because you need to know that in pediatric oncology, the accessibility to new innovative drugs is as far not as good as in adult oncology, where we have lots of new drugs, new treatments, new trials. But pediatric oncology is lagging behind there. But we have shown with INFORM that the targets are there, but the treatments are lagging behind. I hope that, I mean, in the last 5 years, we were able to provide a benefit for a small but significant group of patients, and I hope that we will be able to provide new diagnostics or new drugs in the next 5 years. If we would make such a step every couple of years, that would be really great and a good way forward.